Hey everybody, it is episode 341. We're talking the elephant in the room.
Hey everybody, welcome back to the Prime Podcast. I'm your host, Dr. Skip Wyss. I have the beautifully, wonderfully radiant co-host, Dr. Julie Wyss, with me today. How are you?
I'm great.
Yeah, I know we're talking about elephants, so is it like, are we talking about circus peanuts?
Ooh, that was
probably the worst ever
nutritious.
created candy in the
You'd
world.
be better off eating the packing peanuts that come in your shipping boxes.
Yeah. Well, if you guys have watched this podcast before in the past, you know that if I have my glasses on, I'm obviously going to be reading you something. So, Dr. Julie, I'm going to read you some stuff here. Okay?
Sure.
Side effects, and you tell me what you think it's involving. What if this is a like drug or whatever.
I'll tell you if I want to have it. Yeah.
Common, usually mild side effects: nausea, stomach upset or mild stomach pains, headache, migraine, rash, rare but mild. Serious side effects: seek medical attention right away. Allergic reaction, swelling of the face, tongue, throat, severe rash, difficulty breathing. Liver damage, most significant risk, especially with overdose or long-term high exposure. Yellowing of the skin, eyes, jaundice. Dark urine, that's a problem. Upper right abdominal pain, that's liver. Unusual fatigue or weakness. Severe skin reactions, rare, such as Stevens-Johnson syndrome or toxic epidermal necrolysis, which is the breakdown of your skin completely.
Yeah.
Taking more than 4,000 milligrams a day in adults can cause severe liver damage. Combining with alcohol, having liver disease, liver. And then if I go on to the actual, that's the actual just flat out chemical name of this drug. Then if we go into the actual name brand name of this drug, it's the same exact side effects. But here's what's funny. It says usage during pregnancy or breastfeeding. They recommend asking a health professional before use.
I feel like this is the point when like all of that should be like on the bottom of the TV commercial, right? That it has you running through and frolicking through the green grass. Maybe it's a pregnant mom laying there happy, and these are all the side effects that are along the bottom. Like that is a huge liver focus, right? Like, I don't know, I kind of want to keep my liver.
Yep. And nausea, vomiting, abdominal pain, diarrhea, constipation, headaches, trouble sleeping, insomnia, according to the Cleveland Clinic. Drugs.com, lots of rash issues, lots of stomach issues, lots of liver issues. At least it doesn't show anal leakage, which is most cancer medication. So what do you think I'm talking about?
Well, because I think it's been in the news as of late. Are we talking like pain reducer, fever reducer, NSAIDs?
Yeah, acetaminophen, exactly.
Acetaminophen.
Yeah, and there's a couple name brands out there as well. But acetaminophen is what the chemical name is of it. And you can look it up and find the other producers of this that have stuck their names on it. But acetaminophen is a very common pain relief drug, right? And now, mind you, we're not going to be giving medical information here. We're just posing questions. I'm going to pose a question. The government came out last week and said that there is a correlation between acetaminophen use during pregnancy and the risk of ADD, ADHD, and autism. There's a correlation. Okay. Sure. But the funny thing is that the government itself didn't do the study. Okay? It was a correlation made out of a university research lab, not by the government. And Robert F. Kennedy brought it to light. And then they made this statement, which is what's made everybody super upset.
Sure.
Because I believe they use the word cause versus correlation. I would have to go back and actually watch the video. But regardless, we hear the "ka" word, and we assume that it's a direct one-to-one correlation, which there is a multiple of factors going into neurodevelopmental issues in children. But when the question gets posed, it's designed to make us critically think and maybe ask, is this safe or not?
Is this right for me?
Is this right for me? Correct. And what I'm really wondering, being chiropractors, doctors of actual cause, is, okay, so let's say that there is enough evidence to show that there's a correlation to problems and birth defects from things that moms take during their pregnancies. In particular, when they're interventions for pain or interventions for nausea. Shouldn't we ask what's causing the issue in the first place that is resulting in them having to actually take something to get the symptom to go away? Shouldn't that be the actual question? What's causing this?
One would think, but I think that's what sets our profession apart, because if we look at traditional OBs, MDs, right, they only have certain tools.
Right.
And so if you're pregnant, the option isn't to end that pregnancy or to harvest that baby. The only option that they have is a medication. Right.
And if we're basing these comments based on research behind studies, it is common knowledge across any healthcare profession, medical, therapeutic, chiropractic, as to who's funding the study that is then turning out to be in favor of whoever's funding it. And it happens a majority of the time. You rarely see studies come out contradicting whoever's funding the study.
Well,
rarely.
Most medical schools are funded by pharmaceuticals.
Exactly. And if I'm funding the studies, and then the studies come out and say that my XYZ is safe, and then I publish them in the journals that as a student is taught to believe as the end-all be-all gold standard of publication, then my education is going to lead me to believe whatever's put in these publications. Case in point, the stuff that's in ACOG, where our good friends, we have people that are OBs, we have people that are birth workers coming out and standing up against what the government said. But the reason why they're standing up against it is because the institution that has led them to believe of what they're saying is true is that's what they're putting out there. So they're taught no different.
And I understand that you want to have conviction, and I appreciate the conviction.
Yeah.
But I think everything needs to always, we still need to individually be doing our own research. We can't just assume. I mean, we can look at any of the schools, right? As soon as there is a person or a book that you're reading, that's written by man or women, right? But there's it's not black and white. And so we need to question things. And I understand the conviction of this is what we've learned and this is what we've been taught, and the belief in that. But at a certain point when we maybe see things or when things aren't changing after we're constantly recommending we'll do this and there's no change, then maybe we need to figure out, well, what else can be done? What other services can we use?
Yeah, ask the damn questions. Like, why, as a healthcare provider, why wouldn't I want to know how to take care of somebody's pain more than just throw a pharmaceutical, a drug, a chemical at them when I'm trying to figure out what's going on? And I had made a post last week regarding this exact thing. The elephant in the room is the chronic pain during pregnancy. That's what it is. So let's address that. Let's talk about that. Why is that happening? If we're to the point where moms need nonsteroidals or even stronger medication to deal with a symptom like extreme pain, migraines, headaches, vaginal pain, pubic bone pain, coccyx pain, constipation, diarrhea, all of these things that didn't used to be real common with pregnancy, but is now, doesn't that lead us to understand that maybe things have gotten a little bit more toxic than they used to be? Maybe that moms have a lot more inflammation in their body than what they used to have. Maybe they have a lot more stress going on, considering that when they're told they're pregnant, they are immediately put on a calendar, a clock, and that clock has a stop point. And if you don't reach that stop point, we're going in and taking it out anyways, regardless. Like, that's a lot of stress on an expectant mom. Plus, every other community that she's in, telling her what's good, what's bad, putting tons of stress on her, maybe calling her a good mom, a bad mom, a horrible mom, because they're being judged and ridiculed by the people in their surrounding community instead of what's going on inside their four walls of their house. Like, all of these things gang up on moms, and then that will result in excess stress in the body, which then results in these symptoms, right?
Yeah, and it's not even, people aren't going to Google anymore and asking Google, like Dr. Google.
No, they're going
right?
to chat.
They're going to chat, but then they're going into these groups. And we started this with the side effects, and it said if you're pregnant or breastfeeding, to consult your doctor.
It says consult a healthcare
professional. So
who is that?
The people.
Who's the healthcare professional? So go on.
Yeah.
Sorry.
But that's where I see these conversations in these moms groups. And so we're not even following the recommendations on the bottle that we're considering taking. And it's, well, that worked fine for me and my child is okay.
But are they?
Correct. But are they? But are you just like that other person?
Right. Am I doing this because everybody else is doing it, or am I actually asking the questions? And all that we're asking is, the moms that are out there listening, is to ask critically. Ask questions. You can ask them to us. I don't care. Put us on the spot. Ask us tough questions. I will happily try to answer them for you. Have an actual real conversation, maybe a debate, so you can see both sides of the issue. But at the end of the day, it makes us both smarter because I understand your worldview and you understand mine. That's what Charlie Kirk ran off of. And I'm not going to take time to talk about Charlie, but that open dialogue is what needs to happen. But going back to just a little bit, because I went on a tangent and I apologize, is the chronic pain epidemic during pregnancy. And the number one symptom in the first trimester is headaches and migraines and nausea. Headaches, migraines, and nausea. So what has went on pharmaceutically wise, I'm not putting this on your MD, your OB, or your midwife. What has happened in industry wise, in the pharmaceutical industry, is they developed pills to take care of each one of these symptoms without going through or properly testing these on pregnancy, because you're not going to do that. Well, it's
unethical.
That's unethical. That's unethical. Why would you do that?
But everybody that's doing it now, right, you are the test cases.
And you're not a pregnant rat. You're not a pregnant mouse. You don't even have the similar genetics, let alone anatomy. And we're relying on mouse and rat studies to tell you it's okay. But how are they going to test the psychology of a rat later on when it's growing outside of you? They're not. They can't. A freaking maze study? Like, for real. Like, right. Okay, so that aside, we have to look at this from a different perspective now, because it's been posed, is why is this happening? Nausea is due to a change in progesterone and estrogen balance in the body, and it usually lasts 6 to 12 weeks through that first trimester, right around in there. If it goes longer, even going up to that, we need to figure out why are we having this nausea. Is there a change in estrogen that's still there? Is there an overabundance of progesterone? Are we lacking B vitamins? Could we have a magnesium imbalance? Could we have a ferritin store, which is your iron stores, imbalance? Like, what are these things?
Well, and I think the big thing is that I think just as a society, we talked about the different stressors that we have, and we are going into pregnancy, like we're going into battle, like we haven't trained for it. And so if we look at the culture and we are unhealthy in general as a culture, right? But maybe we feel like we're just getting by. As soon as we become pregnant, and then we can keep that pregnancy, right? Because infertility, that's a big part of this conversation as well. But if we can hold that pregnancy, that's where all these things start to come out of the woodwork.
Yep.
These things are highlighted because now we have to take care of somebody.
Yep.
This baby is going to take everything that it needs from us as a mom. And that's why then we have nausea. That's why we have morning sickness. That's why these things perk up. It's not just because I'm pregnant. It's because of all of the unhealthy things or the unhealthy way that we've been that is now highlighted because of pregnancy.
So you're saying that toxicity and deficiencies of mom is what's leading to these symptoms.
That's a big part of
You're
it.
exactly right. And the other side of that would be the nervous system.
Mm-hmm.
And that's where we come in as chiropractors. And I will grandstand on this and talk about it constantly because my passion is taking care of pregnant moms.
Like, I kind of smile, I kind of chuckle because our moms maybe come in that way. That might be how they first find us, but that is not once they start care. This is not something that they're blessed with.
Within
which is awesome.
minutes of them getting adjusted, if not within a few days, they all feel different, better. Their pain changes. The most debilitating pain for a mom is sciatica and pubic bone pain.
Oh,
it's the worst. And there is nothing that I have seen that is more effective than proper corrective chiropractic care, precise chiropractic care to help moms out. The next worst pain that I believe during pregnancy, from what I've known with you, is rib pain. And it's right or left-sided. It's never both-sided. It sits right underneath your breasts. It wraps around to the back.
When you can't take a deep breath.
Exactly.
Yes.
Below your bra strap, you get burning, pain, zinging. If you've ever had a rib out of place, it hurts like hell. Now imagine that, guys, if you had that for 40 weeks while carrying a child and it's not getting any better because baby's getting bigger. But these are all mechanical changes that are directly affecting and caused by neurological change. And when the brain can't effectively talk to these areas and focus and heal it, it will not function appropriately. And most moms that end up pregnant and have low back pain had low back pain in their teens. They had really hard menstrual cycles in their teens. They had growing pains when they were 8, 9, 10 years old. They had bedwetting issues when they were younger than that. So you can see this pelvic distortion subluxation complex. It's a PDSC. It's a big word. But when that happens, we get misalignment. We get subluxation. We get a change in how the brain talks to the body. Now the body starts doing its own thing, and the resultant is pain because eventually these sensors start telling you something is wrong. And it's not just because you got pregnant.
I know, but if you think about it, if I'm cooking a baby, I want those alarms to be going off to let me know something's not right.
Yes.
And to take a medication, even an over-the-counter, to mask and cover those symptoms, then what are we doing to our bodies? What are we doing to our baby?
Well, we're covering it up. We're treating things with more chemicals. And I'm telling you right now, God designed you as a female to have babies, support families, have babies naturally as much as possible, procreate and actually expand the Earth's population. You've been designed for that. So why in the world would something that beautiful cause so many issues leading up to birth?
Right.
Why? Why? So we have to look at this. Has to be a man-made issue. Has to be. Now, if we go back and people are really upset because something was brought out, right, to treat pain. Yep. But we have to figure, like you said, the pain is the issue. The pain. So what's causing it? And PDSC, pelvic distortion complex, happens all the time. Subluxation in the upper neck happens all the time. This is where all of the migraines come from. All of the headaches come from. All of the sinusitis, congestion. Now, some of these things are designed to increase as you are pregnant. You're going to smell different. Your olfactory senses change. Your vision changes. You become hyper aware and hyper acute of everything around you. Your hearing changes. Everything. Your hair color could change. Your body compensation and morphology will change. All of this changes. But what shouldn't change is you feeling good. Because ask yourself this question. Why is it that Mary sitting next to Patty Patty has tons of sciatica, low back pain, can't breathe, all these issues. And Mary wants to get pregnant 80 times over because she's having the best pregnancy possible, absolutely loves it, feels amazing, has no side effects, nothing. And she's just walking around the envy of most moms, but she's feeling great. What's the difference? Well, if I told you that Mary quite possibly could be under chiropractic care, what would you say?
Well, you know, Mary probably lives a different lifestyle.
She probably lives a different lifestyle. And those lifestyle changes directly impact your health. Directly. But what I'm concerned about the most is the lack of communication inside of our profession, talking about the massive elephant in the room as to why are moms having to take these drugs
when there are solutions,
when there are
available.
Massively easy, effective solutions, and why are our counterparts in allopathy not giving the moms the solutions that they need versus just saying, this is safe. Mm-hmm. Why have we not created a birth community involving everyone, including allopathic doctors, OBGYNs, nurse midwives? Why are we not actively working together versus being a one-stop shop?
Right. For the betterment of the pregnant mom.
Yeah, versus the betterment of themselves or the business. Mm-hmm. It's just it's just not okay with me.
Lots of questions.
Lots of questions, lots of concerns. And I'm concerned because I'm like, this office, Prime Family Chiropractic Centers, and Dr. Julie and I, we're on a mission to have as many healthy pregnancies come in and out of our office as possible. Beautiful pregnancies.
Populate the world.
Populate the world. Happy moms. Because unhappy moms, stressed moms, they know that everything changes at home when they're not feeling good.
Well, and then a stressed, unhappy mom raises sick kids.
Yeah. Yes, absolutely. And we don't want that. I don't think there's a single mom that wants it either.
Hey, but that's why we are the official sponsors of healthy and happy pregnancies in Northeast Wisconsin.
You know it. You know it. Because we are. And we want moms healthy. We want them happy. We want them to have the least interventions during their pregnancies and deliveries so they can have happy, healthy kids. And I mean, that's the best thing. So the elephant in the room is the pain. The elephant in the room is the symptoms. So why are we not addressing these and just trying to cover them up? It just makes zero sense. We're here. We have solutions. We can help. Reach out. Leave us a comment below. Like, ask us questions. We will happily help them. And answer them. Help them. We'll help your questions too. We'll answer. Do you have anything else, Dr. Julie? This has been a really important podcast to have.
Very important. If there is somebody that you know that's pregnant or expecting, or they just have that birth story that was absolutely horrendous and they're thinking about more, please pass us along to them. Get them in touch. We can find other pediatric pregnancy chiropractors, but the biggest thing is to know that there are other resources.
There are other options, so share them. Go out there. Have a great day. Bye, everyone.